Honorable Alternate Minister of Health, Irini Agapidaki, UNICEF Representative Greece, Mr. Khalil, the WHO representative in Greece and head of the Quality Office, João Breda, ambassadors, distinguished guests, all protocol observed. Kalimera. It is a great honor to participate in this important event, and I would like to warmly congratulate the Hellenic Republic and UNICEF Greece for the leadership demonstrated through the National Action Against Childhood Obesity Initiative. Greece has developed a comprehensive and forward-looking strategy combining prevention, community engagement, school-based interventions, healthcare services, and digital innovation. Portugal strongly values this integrated approach, which reflects our shared understanding that childhood obesity can only be addressed through coordinated action across sectors and throughout the life course. In Portugal, we have similarly prioritized action in schools, including legislation regulating food environments in school settings, improved nutritional standards in school meals, and restrictions on less healthy food options in vending machines and cafeterias. School meals also play an important social role, ensuring equitable access to health food for children from more vulnerable families. We also currently strengthening our national school health program with a renewed focus on healthy eating, physical activity, and obesity prevention. Despite progress, unhealthy diets and overweight remain among the leading risk factors for disease burden and premature mortality in Portugal. However, there are also encouraging signs, I would say. Recent evidence suggests a possible stabilization and even slight decline in childhood obesity trends, showing that sustained public policy action can make a difference. We know that reversing this trend requires effective evidence-based public policies that shape healthier food environments, and these include reformulation, marketing restrictions, healthier public food provision, and fiscal measures, all identified by the WHO and highly cost-effective interventions. And Portugal has implemented a broad set of structural measures aligned with these recommendations. One key example is the taxation on sugar-sweetened beverages, which has contributed not only to reduce consumption, but also to significant product reformulation with a marked reduction in sugar content in soft drinks. We have also introduced legislation restricting the marketing of unhealthy foods to children, including in digital environment, recognizing the strong influence of online platforms and social media on dietary behaviors. Another important pillar is food reformulation. Through agreements with the food industry and retail sector, Portugal has achieved measurable reductions in salt and sugar contents across multiple food categories. And in this context, Portugal has recently received recognition from the WHO for the elimination of industrially produced trans fats. And this is a major public health milestone, and trans fats are strongly associated with cardiovascular disease and premature mortality, and their elimination is considered by WHO one of the most effective and cost-efficient interventions to save lives. This achievement reflects sustained collaboration between public institutions and scientific partners, including the National Institute of Health, Dr. Ricardo Jorge, a WHO collaborating center, which has played a key role in monitoring and generating evidence to support public policy action. It demonstrates how science, regulation, and intersectoral cooperation can deliver concrete and measurable health gains. At the same time, we are addressing inequalities in access to healthy diets, including through the redesign of food assistance programs to ensure alignment with healthy nutrition standards. Healthy eating must be a right, not a privilege. We also recognize that prevention must stay early in life and start early in life, particularly during the first 1,000 days, through breastfeeding promotion, early nutrition, and health literacy. And finally, we are strengthening integrated care for people living with obesity, including through a national integrated care model and a new national roadmap to accelerate prevention and control, aligned with WHO targets for 2030. We are also recognizing and reinforcing the collaboration with municipalities, recognizing their essential role in creating healthier environments at local level. In conclusion, Portugal remains fully committed to a comprehensive approach that combines prevention, health system response, and intersectoral action. The work developed by Greece is highly commendable and demonstrates the importance of sustained political commitment and innovation in addressing childhood obesity. Congratulations. At the time when childhood obesity continues to rise globally, initiatives such as these are essential not only for the policies they implement, but because they help build a shared international movement towards healthier, fairer futures for children. Portugal remains fully committed to these collective efforts in close collaboration with Greece, UNICEF, WHO, and all partners working to turn the tide on childhood obesity. Thank you very much. Sas Efaristos Pillai.